So if you look at a medical chart for the human heart, the terminology actually makes a certain kind of, logical sense.
Right. It's very structured.
Yeah, exactly.
Mhm.
Like we have words like cardiac, and then we have words like coronary.
Yeah.
And they sound different because they're describing two completely different aspects of the heart's anatomy.
Yeah, the muscle tissue versus the blood vessels wrapping around it.
Right, it's modular, it's precise. But then you look at the kidney.
Oh, yeah. The kidney is a whole different story.
It really is.
Yeah.
Your kidney has these two ancient, completely different names that are used constantly in modern medicine, like nephro and reno. And here's the truly bizarre part about that. They mean the exact same thing.
They do. It basically breaks the unwritten rule of scientific naming.
Right.
Because, I mean, you expect a highly technical field to use one standard term, right, just to avoid confusion. But with the kidney, we somehow ended up with these etymological twins from two entirely different languages just kind of sharing the workload.
Which is wild.
Yeah. So nephro comes from the Greek word nephros, and reno comes from the Latin word ren, or the plural renes. And there is absolutely no shade of meaning separating what a kidney is between those two roots. I mean, they both just mean kidney.
Well, welcome to today's deep dive. We have a genuinely fascinating stack of medical history and linguistic sources in front of us today. And for you listening right now, our mission is to decode this hidden language.
It's a fun one.
It really is. Because why does this single hardworking organ require a dual language system? Because it turns out doctors use both of these prefixes every single day, and the way they use them is anything but random.
Yeah, what we're actually looking at here isn't a debate about anatomy. It's a centuries-long sorting process.
How so?
Well, over hundreds of years, these two overlapping vocabularies essentially partitioned themselves. They created this lopsided, sometimes deeply confusing, but incredibly precise division of linguistic labor.
Okay, I mean, English medical vocabulary inherited both, right? Like a Greek scientific register and a Latin descriptive one.
Exactly. And for most organs, one root eventually won out and the other just faded into obscurity. But for the kidney, both survived in full force.
Okay, let's unpack this. Because if they mean the exact same thing, how on earth did we end up splitting the job? I mean, who made the call that we were going to keep both of them?
Well, that's the thing. Nobody made a conscious call. It was basically an accident of publishing habits during the Renaissance.
Really? Just an accident?
Yeah. Neither of these roots was coined by a modern scientist. The Greek nephros was used by Hippocrates in the 5th century BCE, and the Latin renes was heavily used by Roman medical writers, like Celsus in the 1st century CE.
Wow, okay, so they go way back.
They do. But the reason both survived into modern English traces back to the 1500s. That's when anatomists started performing direct human dissections and, publishing their findings.
No, like Andreas Vesalius in his 1543 text, the De Humani Corporis Fabrica.
Yes, exactly. That is the defining text. And when Vesalius and his peers published, they wrote in Latin, because Latin was the scholarly lingua franca of Europe at the time.
Right, so if you wanted a scholar in Italy and another one in England to read your anatomical maps, you just use Latin.
Precisely. So Latin became the hardwired default for everyday clinical adjectives describing normal, healthy anatomical structures.
It mapped the terrain.
Exactly. It mapped the terrain. That is why today, if a doctor is describing the healthy baseline structure of the organ, they say renal artery, renal cortex, or renal pelvis.
Okay, that makes sense. That covers the normal anatomy. But obviously bodies get sick. So when things break down, where does the Greek come in?
Well, the Greek comes roaring back in the 19th century.
Oh?
Yeah. Medicine experienced an absolute explosion in clinical pathology around that time. Doctors stopped merely mapping normal anatomy and they started systematically classifying diseases and, surgical procedures.
Right.
And when they did this, they leaned heavily on Greek, purely for practical reasons. Greek combining forms are just incredibly modular. They glue together perfectly to build these complex compound words.
So it's essentially a linguistic Lego set.
Very much so. I mean, if you want to say inflammation of the kidney, you just take the Greek root and snap on anitis to get nephritis.
Ah, I see.
Yeah. A tumor becomes nephroma. Surgical removal is a nephrectomy. Latin simply does not compound with suffixes like that as elegantly. Greek was just a vastly superior, flexible tool for building this new, complicated diagnostic vocabulary.
Okay, let's unpack this with an analogy. So it's basically like having two distinct sets of tools. Latin is the architectural blueprint used when building or describing the physical house, like the normal anatomy.
Right.
But the moment a pipe bursts and you have to call in the plumber to fix a disease, they exclusively speak Greek.
That captures the dynamic perfectly. You use your Latin blueprint to locate the renal artery, but the Greek plumber steps in for the nephrectomy.
I love that. But wait, if the Latin blueprint describes the physical structure, what happens when we zoom in on the actual microscopic hardware doing the filtering?
Yeah.
Does that belong to the Latin map or the Greek plumber?
Oh, the hardware itself belongs firmly to the Greeks. Yep. The functional filtering unit of the kidney is called the nephron.
Ah, nephron. Greek.
Exactly. A single nephron is this microscopic loop of tubules connected to a tiny blood-filtering capillary tuft called the glomerulus. It's where the actual work of filtering blood, reabsorbing nutrients, and creating urine happens.
Right.
And for decades, generations of medical students were taught this apparent biological constant, that every human has exactly 1 million nephrons per kidney.
Yeah, it's always stated with such authority in the older textbooks. Just a neat, round 1 million microscopic filters humming along.
Right.
But wait, if you're dealing with something that microscopic, how do you even verify a number like that without just guessing?
Well, historically, they were essentially doing highly educated guesswork, which is why the 1 million myth persisted for so long.
Wow.
Yeah, it wasn't actually until the 2000s and 2010s that an anatomist named John Bertram and his colleagues applied something called stereological counting.
Stereological counting. Okay, break that down for us. What is that?
Okay, imagine trying to count the exact number of chocolate chips in a baked loaf of chocolate chip bread. But you can't crumble the whole thing to dust.
Right, impossible.
Exactly, you can't. But what you can do is take extremely thin, precise slices of the bread, count the chips you see on those 2D slices, and then use complex mathematical formulas to accurately estimate the 3D total.
Oh, wow. That's clever.
Yeah. So Bertram used these unbiased counting methods on human kidneys and completely shattered the textbook myth. The number of nephrons is not 1 million. It actually varies enormously from person to person.
Wait, really? So your kidney's most basic, like how many working parts do I have number, isn't standardized like a shoe size?
Not even close. They found healthy kidneys with only a couple 100,000 nephrons and others with upwards of 2 or 3 million.
Are you serious?
Yeah. That is a roughly 10-fold range between individuals who had absolutely no diagnosed kidney disease at the time of death.
A 10-fold difference in the basic filtration hardware of your body is staggering.
Mm-hmm.
I mean, if someone is born with only 200,000, do they grow more as they age to catch up?
See, this raises a huge point, and it's where the medical stakes become incredibly high. Your nephron number is finalized mostly before you are even born.
Oh, wow.
It is deeply influenced by the intrauterine environment, so things like maternal nutrition and low birth weight play a massive role. And crucially, nephrons cannot regenerate. Once a nephron dies or is destroyed, it is gone forever.
Because there's no regenerative backup system.
Yeah.
So if you start with 3 million nephrons, you have a massive buffer. You can afford to lose the few 100,000 over a lifetime to normal aging or minor infections.
Right, exactly.
But if you start with only 300,000, every single one of those filters is entirely load-bearing from day one.
Yes. And that low endowment is now understood as a major lifelong risk factor for developing severe hypertension and chronic kidney disease decades later in life.
That makes total sense.
The remaining nephrons just have to work exponentially harder to filter the same volume of blood, which leads to a state called hyperfiltration, and that eventually just burns them out.
Which means we are officially entering the world of pathology. The pipes are breaking down. And according to our sources, this leads us into one of the most frustrating traps in all of medical school.
Oh, the terminology trap, yes. To understand this, we have to look at a landmark moment in 1827. A physician named Richard Bright published his reports of medical cases.
Okay.
He described patients suffering from dropsy, which is an older term for severe swelling, or edema, whose urine contained a high amount of albumin, a protein. When Bright performed autopsies, he consistently found characteristic damage to their kidneys.
And this effectively birthed scientific nephrology, right? Because they finally linked the external symptom, the swelling, to the internal organ damage?
Exactly. For over a century, the medical community just called this clinical picture Bright's disease. It was basically a catch-all bucket for kidney failure. But as 20th century pathology advanced and we got better microscopes, scientists realized Bright's disease wasn't a single condition. It unwound into specific, distinct categories. And this is where the linguistic trap snaps shut.
Here we go.
The terminology split into two syndromes that sound almost completely identical: nephritic syndrome and nephrotic syndrome.
Okay, nephritic with an I and nephrotic with an O. That sounds like a cruel joke to play on students taking a multiple-choice exam. They're literally one vowel apart.
Right. And what's fascinating here is how that one single vowel change, the suffixes, nephritic versus aphotic, describes totally opposite mechanisms of failure at the microscopic level. They are not just mild versus severe versions of the same disease.
Okay, we need to pull these two apart because this is crucial for anyone listening trying to decode medical jargon. Let's start with nephritic syndrome, the one with an I.
Okay, so nephritic syndrome stems from the root nephritis. The grelitis suffix always indicates an active inflammatory process. Think appendicitis or tonsillitis.
Right, inflammation.
Exactly. In the kidney, inflammatory cells attack the glomerulus, that tiny capillary tuft. The inflammation literally tears holes in the physical filtration barrier. It breaks the pipes.
Oh, wow.
Yeah, and because there are physical holes, large things that should never make it into your urine start leaking through, specifically red blood cells. So the hallmark of nephritic syndrome is blood in the urine, along with high blood pressure, because the kidney is desperately trying to manage the restricted blood flow.
Okay, so nephritic with an I equals inflammation. Broken pipes, physical tears, and red blood cells leaking out.
Yes.
Contrast that with nephrotic syndrome with an O.
Right. So nephrotic syndrome comes from nephrosis. The osis suffix generally points to a degenerative structural breakdown rather than an active, fiery inflammation.
Okay.
In nephrotic syndrome, the filtration barrier doesn't necessarily tear open to let whole blood cells through. Instead, its specialized charge and microscopic structure degrade, which allows a massive, continuous loss of protein into the urine.
And losing protein doesn't sound that bad until you realize what protein actually does in the blood. Our sources mentioned oncotic pressure, which is kind of a complex concept. Let's translate that for everyone.
Sure. Think of the proteins in your blood, specifically albumin, as microscopic sponges. They exert a magnetic pull, called oncotic pressure, that basically holds water inside your blood vessels.
Okay.
As long as you have enough protein sponges in your veins, the fluid stays exactly where it belongs.
But if your kidney filter degrades and you start urinating out all your albumin sponges.
You lose the magnetic pull.
Wow.
Yeah. The fluid has nothing holding it inside the blood vessels anymore, so it just seeps out of the capillaries and pools in the surrounding tissues. This causes massive, severe swelling or edema all over the body.
That is wild. The exact same organ, the exact same Greek root, just a one-vowel difference. Nephritic is an inflammatory tear, letting blood out. Nephrotic is a structural degradation, letting the protein sponges out, causing your tissues to flood with water.
Exactly.
No wonder it is the most reliably confused topic on medical exams.
Oh, absolutely. The linguistic overlap masks completely different mechanical realities.
So Greek really dominates the filtering structure and the diseases that destroy it.
Yeah.
But, the kidney isn't just a passive physical filter. It is also an incredibly powerful chemical factory.
Yes, it is.
And when we talk about the hormones the kidney produces, the Latin side of our linguistic map suddenly takes its revenge.
It definitely does. So in 1898, a Swedish physiologist named Robert Tigerstedt and his student Per Bergman were conducting experiments to figure out if the kidney had chemical effects on the body.
Okay.
They ground up material from rabbit kidneys to create an extract, and then they injected that extract directly into the bloodstream of other rabbits.
Wait, what happens when you inject raw kidney extract into a rabbit?
Well, they observed an immediate massive spike in the rabbit's blood pressure.
Oh, wow.
Yeah. They realized they hadn't just injected tissue. They had injected a highly active, potent substance secreted by the kidney designed specifically to regulate blood pressure.
And they had to name it.
They named it renin.
Renin. Straight from the Latin root ren, not from the Greek nephro.
Exactly. And that single rabbit experiment planted the seed for what we now call the renin-angiotensin-aldosterone system, or RAAS. It is a hormonal cascade that acts as one of the body's central blood pressure control pathways.
Which is huge today, Brianna.
Yes, Siv. If you or a family member takes an ACE inhibitor, which is one of the most common blood pressure medications in the world today, that modern drug is directly manipulating the exact hormonal system Tigerstedt discovered in 1898.
Think about the molecular split loyalty going on here. The physical filter itself, the cellular structure doing the work, is Greek, the nephron. But the hormone synthesized and secreted by that very same filter is Latin renin.
It is wild.
It's almost absurd how perfectly the historical division of labor settled into place right down to the molecules.
It perfectly reflects the divide.
Yeah.
Latin names the active physiological agent operating within the normal blueprint, while Greek names the cellular structures themselves.
So what does this all mean when we run into a term like the adrenal gland? Because adrenal literally translates to ad, meaning near or toward, and renal, the Latin kidney root. So it just translates to near the kidney.
Right.
Because it has that Latin kidney root in its name, people constantly assume it's part of the kidney's filtration system.
Oh, all the time. It is a classic case of anatomical naming based on geography rather than function. Sometimes it is even called the suprarenal gland, meaning above the kidney, but it has absolutely zero mechanical relationship to the kidney's filtration plumbing.
It is literally just the upstairs neighbor.
Pretty much.
I mean, the adrenal gland produces adrenaline and cortisol stress hormones. It is completely unrelated to the kidney's water and waste business downstairs, but it gets stamped with a kidney-adjacent name purely because of its apartment number.
It trips up students and patients constantly because we naturally assume that a shared linguistic root implies a shared functional purpose. Here, it literally just means they share a zip code.
This split between Latin and Greek isn't just medical trivia for anatomists, though. Our sources point out that this divide creates a very real disciplinary fault line in science today.
It really does. If you walk into a human hospital and talk to a clinician at the bedside, the adjective nephric is dead.
Completely dead.
Nobody says a patient is in nephric failure or points to the nephric artery. They strictly use the Latin renal failure, but if you cross the university campus into the comparative anatomy or embryology departments, the Latin disappears entirely, and Greek absolutely rules.
Why? What are the embryologists doing differently?
Well, they are looking at the developmental history of life. If you study how a human embryo forms a kidney, it doesn't just bed it all at once. It actually goes through 3 distinct successive stages.
Okay.
First, it forms a primitive structure called the pronephros. Then that degrades and it forms a mesonephrosis. Finally, it builds the metanephros.
Those are heavy terms. What do those 3 stages actually represent?
They actually recapitulate, in miniature, the evolutionary history of the vertebrate excretory system.
Wow.
Yeah. The pronephros, the very first stage in a human embryo, is essentially the same functional kidney you see in some primitive fish and amphibian larvae.
That is fascinating.
It is. The human embryo builds a fish kidney, breaks it down, builds a more advanced amphibious kidney, breaks that down, and finally builds the metanephros, which becomes the permanent mammalian kidney. And every single step of that evolutionary journey is described exclusively in Greek.
An embryonic timeline of evolution entirely in Greek. That is incredible. But if we connect this to the bigger picture for the listener, understanding this linguistic split is actually a literal decoding key for your own medical charts, isn't it?
It absolutely is. I mean, chronic kidney disease is quietly pervasive in modern public health, primarily driven by the strain of diabetes and hypertension on those finite nephrons we discussed earlier.
Right.
And kidney damage is frequently completely silent until it is quite advanced, meaning these terms show up constantly in primary care visits, standard blood lab reports, and medication warnings.
So for you listening, if you're looking at your paperwork, you can use this rule to decode what your doctor is actually saying.
Exactly.
If you see the Latin root, like a recommendation for a renal diet or a blood test, checking your renal function, your doctor is talking about normal maintenance, the architectural blueprint.
Yes.
But if a drug warning label says it is nephrotoxic, or your primary care doctor gives you a referral to nephrology, you immediately know you were dealing with disease, structural damage, or a specialized medical intervention. You're no longer dealing with the blueprint. You're calling the Greek plumber.
It really empowers a patient to understand exactly what register of medicine they're dealing with. And of course, when all of those Greek-named nephrons finally succumb to damage and fail entirely, we have to bridge the gap with technology.
Right.
We turn to mechanical intervention, largely thanks to Willem Kalf. In 1943, during the occupation of the Netherlands, he built the first practical rotating drum artificial kidney.
The birth of dialysis, the ultimate mechanical substitute for the microscopic Greek hardware.
Exactly. When the Latin anatomy fails and the Greek pathology takes over, human engineering has to step in to do the work.
It really is a fascinating journey. I mean, we started with Vesalius writing his anatomical blueprints in Latin. We moved to Richard Bright, defining the Greek pathology of kidney failure. We debunked the myth of having exactly 1 million nephrons by slicing up kidneys like chocolate chip bread.
The chocolate chip bread was key.
It really was. And we traced the Latin hormone renin from a 19th century rabbit injection all the way to modern blood pressure medication. The language we use in medicine just isn't a list of vocabulary words.
No, it's a fossil record. It preserves the arguments, the discoveries, and the massive shifts in human perspective over thousands of years.
So here's where it gets really interesting to wrap things up. We've spent this entire deep dive unpacking the intricate dance between nephro and reno. But if you look at a term like uremia, which is the toxic, deadly buildup of waste in the body during severe kidney failure, a word literally translating to urine in the blood, it uses a third, completely separate Greek root. Yeah, it doesn't use nephro or reno at all. It uses ekuteron for urine and haima for blood. It makes you wonder, how many other hidden ancient languages are quietly dictating your medical charts, just waiting to be unpacked?
It is a constant reminder that the diagnostic waters are always deeper and much older than they appear on a modern screen.
So next time you see a medical chart, remember, look for the blueprint, but always keep an eye out for the plumber. Thank you for joining us on this deep dive. Keep questioning the words around you, and we will catch you next time.